Good morning, everyone. My name's Sue Davis. I'm an endocrinologist in Melbourne. So this is, I think, a very important session. It's a session we will all have opinions on, and it's a session about an issue that actually touches everybody's life, because with communication being so rapid, social media so available, I don't think there's anybody whose behaviour is not somehow influenced by the information we're receiving, whether it be accurate or inaccurate. So we're very fortunate to have Claire Wardle, who's Professor from the School of Public Health at Brown University, who is online. She was hoping to be here, but unfortunately is unable to be. She founded an organisation called First Draft in 2015, which is not-for-profit, dealing with the issues that we're going to discuss today. And subsequently, most recently, has founded the Information Futures Lab at Brown University. She's an international leader in the field of misinformation, verification, and user generalized content, and has been very active internationally in this space, including leading social media policy at the UN High Commission for Refugees. So if we could perhaps start by connecting with Claire now, that would be wonderful. And Claire, we look forward to hearing your presentation.
Thank you so much. And I'm so sorry that I am not with you. I can't tell you how disappointed. I was so looking forward to this trip, but I managed to avoid COVID for 2.5 years, mostly by moving to the country and not leaving the front door. And then last month, I went back to Brown University to spend time with our wonderful students. But let's just say there wasn't a lot of masks, and I came down with a particularly bad case of COVID. I'm still testing positive, but I would like to thank you for giving me the excuse of actually having a shower and brushing my hair. So I feel almost human. So I've got some slides, so I'm going to do the infamous share my screen. And I'm going to talk to you today about communicating health in the new media landscape. And as you just heard, I have a PhD in communication, but then I've spent the last decade really in industry thinking about these challenges. And I now co-direct this lab at Brown University where we're trying to combine research and practice, because if we're going to get ourselves out of this particularly challenging problem, we have to get the best of both of those spaces. But I thought I would open. It's morning where you are, it's evening where I am. There might be some heavy heads after last night's gala. So I thought I would just open by giving you a glimpse of the kind of world that myself and my team spend most of our days in, because we spend a lot of our time in the armpits of the internet, and I think it's a useful place to start. So there's a lot of Bill Gates, surprise, surprise. There's a lot of visual content. There's a lot of this horrible block text content, but there's a lot of Bill Gates. There's a lot of not just COVID misinformation. Those of you in the room know that misinformation did not start with the election of Donald Trump in 2016, that health and science misinformation has been a problem globally for an incredibly long time. So, of course, we're also still dealing with all of the challenges around other types of so-called cures and other things. We have things that we call zombie rumors. It doesn't matter how many times they're fact-checked or debunked, they won't go away. And this is a classic one, the banana contaminated with blood that has the HIV virus. This is so well known that, in fact, it's become a meme. And the reason I want to show this is because anybody who is 30 and under and has grown up on the internet, their whole life is through mimetic culture. It's a nod and a wink to trends online, and that's how they make sense of the world. So there's a big generational gap in terms of how people see the world, those who've grown up online and those who haven't. But I like to get people to take memes seriously, which often isn't the case in keynote addresses at medical association conferences, but it's really, really important. Things like TikTok. Unfortunately, TikTok has really grown in popularity. My students at Brown University on average spend 5 hours a day on TikTok. For those of you who don't spend time on it, most of it is first-person storytelling. And so to use that terrible phrase, it's seen as authentic communication. But institutions like the UN are considering actually coming off TikTok because the algorithm just simply won't prioritize institutional TikTok accounts. So this is from the early days of the coronavirus. This is QTok, QAnon on TikTok. Very, very difficult to monitor this kind of visual video content. So very hard to see what people are seeing. And the algorithms are incredibly personalized, which again makes it difficult to respond to what's out there. Closed messaging apps have become increasingly popular, not just WhatsApp, but in many parts of the world, WeChat in China, KakaoTalk in South Korea, Line in Thailand. And many of these spaces are encrypted, which makes it hard for us to monitor. And also when you get these messages, they tend to be from people that you know. And there is not very much provenance, as in you don't get to see much beyond the screenshot. It's hard to do the kind of media literacy work that you would do on a website. This is YouTube, the world's second biggest search engine. And if I just search for vaccine injury, these are the top 3 hits. They're actually news content, but they are first-person stories. So again, these are news organizations. And if you watch the whole thing, you get the nuance and the caveats. If you're just looking for headlines, you tend to see, oh, goodness, look at all these examples of vaccine injury. And apologies for this meme. It's not a meme. It's an outrage meme, we call them. But I want to show you this because this is so much of what we see every day. Very highly emotive, very simplistic and very visual, highly shareable content. And so this is the kind of content that platforms actually say to me, well, what do I do with this? Is this enough to take down? I would say yes, but that's a much bigger conversation and not one to have in America with the First Amendment. But this kind of content we see again and again. And this is Elaine, who I actually put in a lot of my presentations, because I actually think it's incredibly important to understand anti-vaccine spaces, which is where Elaine is spending a lot of her time. This screenshot is actually from 2019. It's before the COVID pandemic. And the reason I like to show this is to say this idea that actually people are passively consuming misinformation or conspiracies and having their behavior changed because of it completely fails to understand that Elaine feels that she is the one that is preventing harm. If you look up a definition of misinformation, it's people sharing false information, not realizing that they're causing harm. Elaine thinks that she's preventing harm. She, as her T-shirt says, feels that she's the one that's informed. She's the one that's reading the science and the research. She might not be drawing the same conclusions as I would, but she is part of something. She's part of a movement, and she feels that she's playing an incredibly important role and feels that she has agency. So I'm going to come back again and again to these themes through the keynote, but I want us to remember that this isn't about people passively consuming false information. So the title of the talk is Communicating Health in the New Media Landscape. But when I got out of my duvet and sofa on Monday, thinking about this keynote, I was like, I think we're missing some keywords. Because really, what we need to be talking about is that this new media landscape is weaponized, it's low trust, and it's networked. So they're the 3 elements that I'm going to focus on in this talk today. And I'm going to show, I think I just showed the screenshot. And this, if anybody in the room worked on it, I just want to say this is a great document. But I just want to highlight the differences between these 2 information ecosystems we're working with. This is 53 plus pages of excellent information, full of complexity and nuance and detail. But there's no diagrams. It's very long. It doesn't open brilliantly on a mobile phone. And so many of us are communicating in this way, and we're up against this. And I'm not saying that we need to move into this direction of having very shocking, emotive content. I'm not saying that at all. But we do have to learn some lessons from the other information ecosystem to understand what's making that tick in order to think about the communications that we're doing ourselves. So that first thing I talked about, the weaponized information environment. For the last 6 years, I've been doing training with newsrooms and saying to them, you are being deliberately targeted. Because a core paradigm of journalism is this idea that more sunlight is a disinfectant. The more you shine a light on something, the more that you're going to, bring good to bad things. But over the last year and a half, I'm having to have those same conversations with scientists to say the same thing is happening. Disinformation agents are deliberately targeting science and scientists to take the credibility that comes from those spaces and to take advantage of that. And that the open way in which we do science, the way that we build on each other's knowledge, all of those things that make science so fundamentally important actually is being turned on itself. And so just to give you some examples, we have real problems at the moment with people taking content from preprints, editorials published in journal articles, and other types of content in established spaces and using that to push their own agenda. So here's just one example, but there are many. This is an editorial that was published. It was not one that I think should be published, but talked about the pandemic as one of the most manipulated infectious disease events in history, characterized by official lies. etc., etc. Now, if I'm trying to push my agenda, I just take these screenshots and I say, look, it was published in a journal. Here's the date of submission. Here's the date of acceptance. And it's not just this journal. We see this in the BMJ and many other spaces, that they are deliberately being weaponized by bad actors. Here's another example from December 2020 from the UK government that published the regulatory approval of the Pfizer vaccine. And within that, there was a statement that said, it is considered that sufficient reassurance of safe use of the vaccine in pregnant women cannot be provided at the present time. And that was true at that time. Now, this was shared like gangbusters and continues to be shared because it did what people wanted it to do, which is to push a particular agenda. And whilst it was correct at that time, in the age of a networked internet, how do we prevent, as science is updated, how do we deal with these problems of when information shifts and changes? And here's a live stream of the CDC advisory panel. 20,000 people watched this live stream. It was 6 hours. And it's not as if people were sharing the 6 hours when scientists were going head to head to discuss their data sets and their research and having open conversations about what they could say, what they couldn't say, what we know, what we don't know, because the bad actors just clipped the sections of this live stream that did the work that they needed doing and then shared it widely to say, look, this is why the vaccine can't be trusted. So in all of these examples, what I'm saying is I'm not saying that we shouldn't be transparent. I struggle sometimes on Twitter when I see these amazing conversations playing out between public health professionals and scientists. I want to say this is such an important conversation, but I wish we could do it in a way that wasn't quite as open right now because it's been weaponized by bad actors who are using us in ways that are incredibly damaging. Because ultimately, what these actors understand is that people are frightened and they are uncertain, and they are constantly looking for opportunities to take trustworthy content from scientists and to use it to their advantage. And that means we need to be aware of this context when we're doing the work that we're doing. And so in terms of how to communicate in a weaponized information environment, before any public, I told you a lot of Bill Gates, before any public facing event, whether that's a new article, a press conference, a communications campaign, we need to get used to doing red teaming exercises. How is it that our messages could be weaponized? When I do talks, I will ask, is this going to be live streamed? Where's this going to end up? And I completely change what I say depending on who I think is going to be hearing those messages. And so this is the kind of thing that we just need to get better at, even though it's upsetting to have these kind of conversations. Unfortunately, it's the truth of the landscape that we're currently working in. And where possible, partner with disinformation experts to help you think about things you didn't even know you didn't know. For example, the way that keywords shift and change. It's hard to even know where some of the landmines are unless you spend all day in the armpits of the internet. And I would recommend that you don't do that and let people like my team do it instead. And finally, we're seeing amazing examples of doctors and nurses out on the front lines on social media, pushing quality information, debunking false information. But unfortunately, many of these people are being harassed, they're being trolled, and we have to do a better job of providing training to ensure that people know how to lock down their accounts, those of their families and their loved ones, and to make sure that we don't lose many people who are doing exceptionally important work. And we need to do much more with the platforms to say these people need to be protected. So in terms of a low trust information environment, you know this, but I'm just going to stop for a second to say, many people say to me, look, misinformation has been around since year dot. Why is it such a problem now? And I think what we have to recognize is over the last 2 decades, many people's lives have been completely turned upside down. And that uncertainty is leading to being drawn towards conspiracy theories and certainty. Because even if we look back at the 2008 financial crisis, no repercussions for those bankers. And people have seen that and want to know why when they have such economic insecurity. In the UK and many other countries, serious corruption scandals, even in the UK around PPE. Again, it took a long time for Boris Johnson to step down. All of this is leading to, and we hear in surveys after surveys, there's no repercussions for people. Why should I trust these institutions? We're seeing, because of wars, famines, climate change, shifts in refugees and migration patterns, which is leading to real uncertainty, both for those who are being forced to flee and also communities who are unsure about what that will mean for people arriving in their communities. We have huge technological change. The iPhone only arrived in 2007. People have seen all of the exciting things that have happened with technology, but also it's happened at such speed. They understand that there's concerns about privacy and surveillance, but nobody's telling them what to do. Everything feels just incredibly uncertain. And finally, you have a generation of people who are told that you are not going to be as well off as your parents. And so for so many people, they want to understand why their life is not clear, why their life is uncertain, why their life is frightening. And in that context, the ambiguity that science provides and policymakers provide, which is this is complex, we're waiting for more data, this is difficult, that's a very, very hard place for humans to spend time. And conspiracy theorists that tell you, actually, this is not your fault, this is a secret cabal of people who are controlling the world, you have nothing, this is nothing to do with you. But however, if you join our community, we will tell you these secret stories about what's happening. This is ultimately about storytelling, persuasive storytelling that provides certainty. And unfortunately, we in our information ecosystem are not providing that uncertainty. So I just want to start with that when we think about low trust. There's a number of reasons why this is happening. But if we look at the Edelman Trust Barometer, and these statistics are from the US, but I just want to say this year, their report, they did work in many, many countries. We talked about a vicious cycle of distrust fueled by government and media. And I'm going to show a few more of their statistics. Australia, amazingly, I was a bit shocked when I looked at these numbers, but things seemed pretty bad in 2012, I have to say. But then things have really improved. But over the last year have taken a turn. And so the question is that trend going to continue or not? So I have to say Australia is such an interesting case study when it comes to trust. I'm certainly from a country and currently live in a country where trust is very low. But what we're seeing is people saying that they are more convinced than ever that they're being lied to by societal leaders. And what I want to say is that after 6 or 7 years of people talking about fake news, what we find is that when you teach people media literacy skills, they are better at spotting misinformation, but they're actually more cynical and critical of all news sources and other trusted sources. So I think we have to be very aware right now that partly because of all these conversations about the information ecosystem, people are just saying, I don't know who to trust. And as a result, they are turning inwards. So we're seeing trends that suggest that people are less likely to trust outsiders or institutions, and they're much more likely to trust those that they have closer bonds with. So that could be a co-worker, it could be a neighbor, it's friends and family. So we're seeing this in the survey results, but we're also seeing it when we do qualitative research with communities, when people say, yeah, made my decision about the vaccine because of conversations at the school gate. Yeah, I was talking to my mates down the pub and this is what they were saying. And so if we have highly qualified and educated friends, we're actually okay. But many people don't have that. And so when we think about the new ways we should be doing communication, it needs to be fundamentally at the community level. We absolutely need to understand these trends and to say, yes, we need to rebuild trust in institutions. But in the meantime, we have to understand that people are turning to one another. And therefore, how can we work with communities to enable them to be sources of quality information? And of course, I heard that you've had many of these conversations about inequity. So much of this also is around income, and no surprises that there are large gaps between high and low income populations. And so we have even more work to do with those communities who have higher levels of distrust, many of them because of lived experience of the kind of institutions who want to say, well, why don't they trust us? Well, it's because many of these communities don't see themselves reflected in newsrooms or in hospitals or at government level. And for many reasons, they themselves have had problematic experiences with those institutions. So when we're thinking about how to communicate in a low trust information environment, and I don't like to have Deloitte in a slide deck, but they actually did some good work with communities of color in the US to understand the need for rebuilding trust in healthcare. And the numbers were pretty staggering. 55% reported a negative experience where they lost trust in a healthcare provider. 36% have skipped care because they did not like the way the healthcare provider or their staff treated them. 80% of participants said there was nothing that could be done that would make them return to that provider. And what people said is they wanted to have a provider who has empathy, is culturally competent, and or looks like them as a top priority. And the reason I think this is so critical, in the US, we've done a lot of work with communities of color to try and understand vaccine hesitancy. And unfortunately, there was a lot of lazy headlines at the beginning of the vaccine rollout that said, oh, Black Americans do not want to get vaccinated because of the Tuskegee experiment, which many of you probably heard of over 50 years ago in the American South, really unethical experiments carried out with Black men, giving them syphilis. Now, the thing is, that was a kind of a very lazy way of understanding it, because when we did lots of research with these communities, they'd be like, yeah, I know Tuskegee, but you're completely forgetting the fact that when I go to my hospital, I'm not being listened to. That when I had a baby, my experience of my childbirth was completely different from the way that my white female friends had a baby. I'm not given enough pain medication, et cetera, et cetera, et cetera. So there was all of these stories about people's lived experience. And so one of the reasons this is so important is because when we talk about communication and trust, there's this sense of like, oh, if only Facebook could just tweak the algorithm. If only Facebook could just prioritize the WHO, we'd all be okay. As opposed to why in this keynote, the point I'm trying to make is so much of the conversation the last 6 or 7 years has been about it's not our problem, it's the digital landscape, as opposed to looking at ourselves to say, how is it that we can work in this new digital landscape in a way that rebuilds trust, in a way that actually feels like we're part of these communities? So last month, we published a report at the Information Futures Lab based on 2 years of research with community-based organizations in 5 locations around the US, primarily communities of color, to try and understand how we can think about rebuilding trust. And we have 12 recommendations. I'm not going to go through all 12, but there's a few that I really want to stress today. And the first one is that we have to be better at communicating the I don't knows. So at the beginning of the pandemic, I heard Joe Smizer from PGP use this analogy, and it hasn't left me. So during wildfire season, of course, I'm talking to people in Australia who you have real lived experience of serious weather events. But he said during wildfire season, you have the fire chief saying, listen to me, right now the fire is here. Tomorrow the fire could be there, or there. I can't tell you where the fire is moving, but follow me and trust me. I'm going to give you the best information as soon as I have it to make sure that you're kept safe. And that's not exactly the same with the pandemic, but we completely failed during the pandemic to own up to those moments when we just didn't know. And so what we did was created these communication vacuums when we were waiting for more data. So an example of that is people's concerns about myocarditis with the rollout of the vaccine. And the CDC and others, you could argue quite rightly, but I would say it doesn't work today, said, we don't have enough data, so we're just not going to say anything. But what that meant was these vacuums were filled by conspiracy theorists who were answering the questions that people were searching for to say, what's the problem with myocarditis? And people were filling it with their first-person stories. And so we have to find new ways in this new information environment to build trust, to keep trust, by saying sometimes we just don't know, but please trust us. When we know, we will tell you. And if you hear anybody tell you ahead of time, they're lying to you. And I know that sounds simplistic, but if we don't solve that, we're going to keep making the same mistakes. Tailoring messaging to your audience and meeting them where they are with messengers that they trust. So this is a classic marketing screenshot, stock photo. But if I was to actually, to spend time with these real people, they're all spending very different amounts of time every day in very different spaces and they trust very different people. And so the days of we just need the right ad on the side of the right bus and that's going to change behavior in the ways that we want, that's no more. We have to understand the splintered information environment dictates the need to have much more tailored messaging. We need to support the building of offline relationships. So many of these conversations are as if it's, again, all digital, when ultimately people might see something on Facebook and then go to have a conversation at the school gate to say, hey, I heard this. Did you hear this? What do you think? There's a moving of information backwards and forwards, and this is hard to resource. It's hard to think about going door to door and working with people in offline spaces, but it's absolutely critical when we think about the work that we need to do. We need to empower communities to lead and co-create messaging with them. So much of this idea I'm seeing is large marketing agencies come up with these templates and then have a toolkit and submit it around, but with no actual conversations with the communities themselves. And this is an example from Baltimore, actually, which got a lot of play because it was humorous. There was a number of them in the kind of campaign. And there was a mini backlash, which was like, oh, this is a white marketing agency that are making fun of Black relationships. And actually, Baltimore came back and said, no, we worked with a number of communities of color across the city, and it was their idea to use humor as a way to resonate with their community. And so it uses all the time to say that has to be the number one place that we start when we're thinking about communications campaigns. And finally, we've got to utilize the power of visuals. If I had a magic wand, I would put a graphic designer and a video production editor in every public health department globally. We can't do that, I understand that, but we have failed to take this kind of communication seriously, and we're playing second fiddle when it comes to the social media environment, or any kind of environment when people are getting used to more simplistic, more visual, more video content as a way to understand the world. We have to spend more, literally spend more money investing in these kind of skills. And we need to tell stories. Those of us who are journalists, researchers, scientists, fact checkers, we all feel pretty uncomfortable with the word I. We like to have a distance, and stories don't necessarily come naturally to us. But we have to get better at this, because that's fundamentally what conspiracies are. They are simple, powerful narratives. And that's what's so compelling. And unfortunately, if we don't become more compelling in the way that we need to take our science, take our research, take our data, and create stories out of them, again, we're going to be on the back foot. And lastly, I want to talk about the networked information environment. So I'm a communication PhD. This is, back to my grad studies. This is a classic model of communication. Who says what, in which channel, to whom, with what effect? If only it was this simple, things would be a lot easier. And it came, obviously, the field came from post-World War II, a fear of propaganda, and this idea that, people simply had to listen to a radio address and they were going to do something terrible. And in many ways, we can say, well, of course, that's laughable. But unfortunately, we still, when you hear lots of conversations from people, have this idea either that, oh, my goodness, somebody's seen an anti-vaccine post on Facebook, they're not going to get vaccinated. That's the hypodermic needle model. Or we just need Kim Kardashian on TikTok to tell people to get vaccinated, and that's going to work. Neither of these things, we know that it's not how communication works, but we still use it. And in fact, I'm not going to play these, but if you want to laugh at some point, there's a nice compilation of anti-marijuana television ads through the years as a reminder of the way that PSAs are still very much built on this idea of communication. And of course, the 70s and 80s, there was a new active audiences model of communication, which was, well, of course, some people they watch an anti-marijuana ad and they're like, oh, okay, I shouldn't do drugs. Okay. And they have the preferred reading. Negotiated reading is like, well, you know what? You're telling me it's going to kill me. A lot of my mates smoke a lot of pot and they're okay, but maybe I'll do less of it. Or the oppositional reading is, that's complete baloney. I'm going to smoke as much pot as I possibly can. And the reason I'm sort of making a joke about it is because when I was at grad school, we got given a lot of money from the federal government to evaluate a series of TV ads where you saw young people in garages smoking marijuana. And the evaluation showed that the more of those ads you saw, the more you wanted to be smoking marijuana in garages because it looked really, really cool. But I say that as a reminder of so much of the conversation about the impact of misinformation still is within this framework of a hypodermic needle model. And it's much more complex than that. And I wish we could recognize and remember what we do know from years and years of the literature. And then the web came along and fundamentally changed everything, because all of a sudden there were just official trusted gatekeepers creating content. Anybody could create content, and people could reshare and remix and do all sorts of things with content and create their own audiences. But the fundamental thing I want to say and make the argument around is that when I say we, I mean newsrooms, researchers, scientists, fact checkers, we all kind of went, oh yeah, the web. Okay. Yeah, that's pretty hard. So maybe what we can do is have a Twitter account, but we'll just tweet out links to PDFs that people can click. Or, well, we'll just tell people at 11 to tune in because we want them to watch our TV channel. We didn't really understand how participatory the web was. But you know who did? The disinformation ecosystem. They absolutely fundamentally understood that the web allows a participatory networked model. And that's why they have been so successful. Because fundamentally, we are now a networked publics. People are in different communities. They're creating content. They're sharing it. They have agency within their own communities. Now, that's very hard for researchers, for us to wrap our hands around. We want to go back to that very simple model of communication. But that's the reality, and that's what we're facing. And what I stress is that we're still using communication techniques that were more likely to work in 1972, but are not working in 2022. We are no longer in an era of a small number of gatekeepers and people passively consuming content. We're in this participatory ecosystem. So unfortunately, there's still this idea of someone says something we're supposed to trust and we consume passively. That's unfortunately too much of the conversations I hear versus the reality of this ecosystem. Because if you spend any time monitoring these communities, type in #health freedom at the beginning of the pandemic, watching people going to their ERs and filming their emergency rooms to say, I don't see any COVID patients. The #vaccine injury, the hashtag where we go one, we go all, which is the QAnon hashtag. These are grassroots movements with a very strong community dynamic. But again, those of us who are researchers, scientists, fact checkers, journalists, we feel pretty uncomfortable with the word movement. That feels like advocacy, and that's not what we do. But how do we recognize that we need to do our work within this context? Because that's why the other side are so successful. So we, and I would say almost everybody in this room, I'm sure, including myself, live in an information environment where we probably wake up and we click on the New York Times or ABC, but it's still very top-down, linear, with traditional ideas about expertise and who can be a spokesperson. It's based on the deficit model, which is more facts are the answer, and there are very few, if any, feedback loops. ABC might, well, it does have a very good Facebook page, but how many staff do they have really listening to what audiences are talking about and the questions that they have and answering those questions? Most journalists are like, oh, the comment sections, no thanks. The other side is dynamic, it's organized, it's participatory. Expertise comes from lived experience. People feel they are heard and they feel they have agency. There's a recognition that humans have an emotional relationship with information, whereas we are still like, I think people have a rational relationship to information. All of us, doesn't matter how educated we are, what political persuasion we are, all of us have an emotional relationship with information. And so whilst this is simplistic, I don't think it's a wrong way of understanding these two spaces, which is the Tony Fauci versus Elaine model. And if we don't understand what's driving Elaine and why she is never going to trust Tony Fauci, where does this take us? And we have to stop having these two very different information ecosystems, because fundamentally they are organized, they understand visual culture, and they understand the network dynamics of the internet. So how do we communicate in a networked information environment? Well, unfortunately, it's not this top-down broadcast model. It's about having peer-to-peer conversations. And let's just talk about Nicki Minaj. Turns out this was about a year ago now when she basically talked about her cousin's testicles and said that that's why she wasn't going to get vaccinated. And she said in this tweet, she'll get vaccinated once I feel I've done enough research. And a journalist responded, your own research, ? Do you have a team of scientists running clinical trials out of a spare bedroom? Snarky, snarky. You can see the engagement there, 32,000 likes, 1.2 thousand retweets. But that's not helping anybody. And this is Kizzy, who was part of the Moderna vaccine team, who is just chef's kiss. I love her so much. But she responded, I empathize with this sentiment. I want every single person to get vaccinated out of their own informed will. And I'm here if you ever want to chat, or I can be your Met date, ha, ha, ha. But just in that one tweet, she did everything that you're meant to do, which is to be non-judgmental, to actually ask, is there anything I can answer? And to say, I want you to be in charge of this decision. You shouldn't just trust people blindly. And this is an infamous now FDA tweet. Again, look at those engagement stats, but let's just say they weren't all yay FDA. In focus group research, this tweet still gets referenced all the time by many, many people who say it was the most condescending, problematic piece of communication they saw during the pandemic. And of course, it was around ivermectin. You are not a horse, you're not a cow. Seriously, you'll stop it. But the problem is, as we know, ivermectin is used safely in many parts of the world for a number of different ailments. And so what people were saying to journalists and the FDA is like, why are you saying that you shouldn't, this is just a vet's treatment? This is actually used safely. And why are you lying about that? And so again, it's how can we properly communicate in a way that has empathy, even for people that we don't really understand what their motivation is. Right now, some of the communication we're doing is actually causing more schisms in our information environment. And so, as many of you know, motivational interviewing is shown to be very effective with a number of different issues that people have and come to see their GP around. But fundamentally, the brilliance of motivational interviewing should not just be for clinicians. It should be the way that anybody talks to anybody else in their community about their fears and concerns. And so the open-ended questions, the affirmations, the reflection, the summary, what Kizzy did without even thinking in her tweet is all the ways that people should be having conversations and communicating with one another about these issues. And I actually worked with the Surgeon General on a community toolkit where we tried to give these skills to community-based organizations to say, you are the best messengers. You are the best people to have these conversations with people in your community who are unsure and who are asking questions. And just finally, I just want to stop and have a moment to get a little bit frustrated, which is back at the beginning of the noughties, this is from 2003, the BBC and probably ABC was doing all sorts of really exciting participatory projects. This was one that was all about asking people to share their experiences and expertise, asking them to share their questions so they could answer them, finding other people in the neighborhood who were doing similar things. It was called ICANN, and it was brilliant. But of course, the powers that be decided that it was too expensive to resource, so it got shut down. This was another example of going to Welsh mining towns to find miners who'd lost their jobs and who had lost hope and felt that nobody had any belief in them anymore. And they worked with these miners, ex-miners, and got them to get their photo boxes out from under the bed and gave them digital skills, enabling them to build these beautiful digital stories. And at the end of it, the evaluation showed that these men had completely felt new empowerment, felt that they were heard, felt completely differently about the BBC. Again, these kind of projects were shut down because they were deemed too expensive. And I'm not saying that if we'd done this, we wouldn't be in the mess we're in now. But I do think that there are some really powerful models that we were starting to do. And I think this shouldn't just be newsrooms. This is how can we embed this in health systems to find ways to make people feel heard and valued and communicate with them in partnership. So in conclusion, fundamentally, people are obsessed with, the Bill Gates is microchipping you ideas. There's all this money going on, to be honest, disinformation labs like myself, where people want us to play whack-a-mole with the worst kind of disinformation. But I often talk about the information supply chain and seeing it as a much, much longer process, when actually, if we were better earlier in the information supply chain at asking people's very valid questions, we wouldn't be creating these vulnerabilities which allow conspiracy theorists to swoop in and answer these questions in ways that are not based in science and other things. So much of when I do this kind of work is to say, we have to look at ourselves to say, how can we be better earlier in the information supply chain rather than waiting for the very worst cases to take hold? Because so much of these kind of conversations and the headlines and the keynote speeches are about the visible health misinformation, the very worst of the worst at the top. But actually, underneath, there's a whole host of this rumour ecosystem, both off and online, just based on people's concerns. People calling each other up being like, I don't know, should I get my new booster at the same time as my flu vaccine? I don't know. I've lost my vaccination card. Can I get my third boost? I don't know. All of this is happening all day long. And we're just not doing a good enough job at responding to people's concerns. And if we did that, I'm not saying that all of the really bad stuff would go away, but I think we'd be better off than we currently are. So I would just say all we need to do, and not all, is listen, do it often so that we can really understand the emerging questions and concerns. And once we know what people are frightened about, how is it that we can then answer those? And I'm just going to leave you with some of my dancing nurses to be a reminder of when we answer these questions, how can we do it in engaging and shareable ways? There's a lot you can say in a 30-second TikTok. Oh, no, we've had enough, thank you. So thank you very much. I'm very happy to answer any questions that people might have.